Welcome to the Allen County Health Equity Coalition meeting for the month of May. We're in May. Yes, for the month of May. My name is Sharon Tubbs. For those who do not know me, I am the director of Health Visions Midwest, and Health Visions Midwest is the overseer of this coalition. So we welcome each and every one of you in person and online with us here today. We are just so glad that you've been able to come and join us. And we know that you're going to get something out of this meeting because we have quite a bit to share with you today. Some great presentations and some information that will be helpful to all of our community leaders. So first of all, we want to start out with an opening meditation. For those who may not know, we are a faith-based organization, but if you're not into faith, if you're not into spiritual things, then that is okay. We continue and still welcome you into this space. But we do start off our meetings with the meditation. If that's not your thing, kind of just be like, hey, let me look on my phone. Let me turn my volume off on the virtual cam and all of that. And that's totally fine with us. Today, our meditation is going to be done by Cassius Stallings, who is our new wellness coordinator. He's the newest member of our Health Visions Midwest team. Everybody, Cassius.
Hi, everyone. Yes, like she said, Cassius Stallings. And before we do our meditation, something that can apply for everyone, even if you're not going to meditate with us, is I want us to acknowledge the moment, respect the pause. Someone entered the room today and I heard them say they are tired. They're tired. And I think that we all are kind of experiencing some fatigue, as we're gearing up, especially for the summer months. Those are months that we hit things hard. We hit the ground running. We see a lot of people are going to make a lot of connections. So let's take a moment. Everyone plant their feet. One more good one. Dear Heavenly Father, we thank you, Lord. We thank you for this time. We ask that you open our hearts and our ears to what it is that we're about to receive, Lord. Just allow it to be good, and that we may take this information and continue just to grow and to continue to develop, Lord. We're just so thankful to be here. We actually continue to bless us and continue to connect us. In Jesus' name, thank you. Amen.
Amen. Okay, thank you, Cassius. And thank you for that pause, I think. I needed that pause, running around, doing things, some of you running around to get here on time. So we kind of need that pause to receive the information that is about to come. So before we start our presentations, again, we've got some goodies today. But before we begin that, I do want to take a time to introduce ourselves. So if everybody in the room, we're just going to go around, you're just going to say your name, and you're going to say which organization that you're representing. If you're not representing a particular organization, that is okay as well. And then we're going to do it with our virtual guests also. So where do we want to start? I think we're going to start. We always start over here, so I'm going to start over here. Yes.
Okay. Gina Brooks with Genesis Outreach.
Okay.
Austin Bratner with Christian Community Healthcare.
Okay.
Jan Moore with Parkview Community Nursing.
Carrie Freiger with Great Heights ABA. Melissa Martinez, Allen County Public Library.
Audrey Dominguez, the Allen County Department of Health.
Lisa Ackerman, Health Advocate Professionals.
And these two are, Xavier is here, and he may not be able to be on screen. I think are you in the blind spot or what have you? So Xavier is here, and he's with Poor Handmaids, our founding ministry, and he is taking the place of our dear Felicia today. So if anybody's missing Felicia, that is why she is on vacation. Xavier is running things. Okay, Xavier Cologne, and then can we see
Me.
Cassius?
Cassius Stallings.
Already introduced himself, and then
Brandy Shorey with Anthem Medicaid.
Okay.
Ann Hall with CTN.
All right.
Kiana Cox with Cancer Services.
Kelly Bauman with Associated Churches.
Okay.
Autumn Trice-Johnson with Purdue Extension.
Okay.
Melissa Fisher, New Wave Wellness, and Faith United Methodist Church.
Peggy Hayes, Health Visions.
All right. And over here,
Lupita, Healthy Shows.
Lupita is, she's probably not on screen, but Lupita with Health Visions. So everyone has been introduced in person. What about virtually? Who do we have in our virtual room?
Slothamer, United Healthcare.
Let me turn it up a little.
Okay, hold on just a second. So we could
All right, let's try that.
hear and see. It sounded like someone was saying something.
Joyce, go again. They didn't hear you.
Oh, Joyce Slothamer, United Healthcare.
Oh, wonderful, Joyce. Okay, so she's on the phone. We're not seeing her face. Is there anyone else who's on just the phone?
I am. I'm Megan with CareSource.
Megan with CareSource is on the phone. Anyone else on the phone that we don't see?
I'm Michaela Dubb. I'm with the Shepherd's Hand.
Okay. Oh, okay. I see them now. All right. All right. So what I'll do is I'll just start calling folks out so we don't get confused based on who I see now that we've got some folks on the phone. So the first person that I see on the screen is Yolanda.
Yolanda Hemp with Shepherd's Hand.
All right. Awesome, Yolanda. And then there's Carlos.
Hello all, my name is Carlos. I'm with Neighborhood Health.
Carlos Clopton, and then John.
John Miller with the Alzheimer's Association, program manager serving North and Northeast Indiana.
Okay, got a big job there. Colleen.
Colleen Carpenter with Stop Suicide Northeast Indiana.
All right. Ty.
Ty Reisner, Brightpoint.
All right. Patty.
Find the mute button. Yes, good morning, everyone. Patty Rose with Purdue Healthcare, not going to my old name, Purdue University I Hope Initiative. Thank you.
Patty's going to be one of our presenters today. Our friend and advisor, Laura.
Laura Dwyer, Catholic Charities, Fort Wayne Southbound.
Awesome. Jared.
Jared Blanchard, I'm a community wellness coordinator for Purdue Extension in Allen County.
Okay, lovely. And I see T. Coyle, Walter. And T. Coyle is muted. Okay.
Yes, this is Tammy Walter with Indiana Donor Network in Northeast Indiana region.
Awesome. And then there's Paula, our executive director. Who's on mute?
Good morning. Good morning, everybody. My name is Paula Wills from Health Vision.
All right. That's the big boss, everybody. Okay, Charity.
She doesn't have a mic, but she said that she is Charity Story, Director of Education and Testing at the Positive Resource Connection.
Awesome. Okay. Megan. Did Megan already introduce herself? Okay, Megan introduced herself from CareSource, and then there's Cara.
Hi, this is Kara Walker. I am representing IU Fort Wayne.
Okay, good. And then Michaela.
Michaela. I am Michaela Dubb from the Shepherd's Hand.
All right, and then Joyce, we heard from, thank you, Joyce. And then there's, our friend Kalila.
Hi, I'm Kalila Hanan from Center for Nonviolence.
Awesome, we've got a couple of people joining in. Nancy. Nancy, you just came in. We're just saying our name and the organization that we're affiliated with in our introductions. That's Nancy Kripe, everybody, from Tobacco Free Allen County. And then Joy is coming in. Joy, we were just saying our name and the organizations that we're affiliated with. And you're muted. That's Joy Losi, everybody, from Lutheran Health Network. So I think that's everybody in the room, and we have a newbie just came through. So we're just saying our names and which organization that we're affiliated with.
My name is Heather Essex. I'm the Racial Justice Coordinator for YWCA, 2 weeks in.
2 weeks in, yay. And was there anyone else that just came in as we were introducing the virtual? Okay, so there are a number of people who are here for the first time or here.
Hey, Sharon, it looks like there's someone who popped on, Xavier.
Oh, Xavier, he's with us.
Oh, okay, cool.
Yeah, he's taking Felicia's place. So Xavier Cologne, I think that is everyone. There are some new people. I didn't stop and pause, but let's clap for all the newbies, people who have been here a long time. We've got our YWCA lady, Jan Moore hasn't been here in a long time. We've got Gina just popping in. We have Brad. Austin, I'm sorry.
That's right.
Okay, but the last name is what?
Brad Mueller.
Okay, so that was what confused me. I knew there was a Brad in there somewhere. And so we've got some people online who have not been with us before. So thank you all for stopping in. You're going to get a lot of information today that I know will be helpful. So without further ado, because we do have a packed agenda, I want to start with our first presentation. That's going to be Miss Autumn Trice-Johnson from Purdue Extension. And Autumn's going to do an important presentation about the social determinants of health. You can come on up here. We already have everything left. We'll get in. Okay. So Autumn is pretty new with Purdue Extension. I would say, because we know her from another organization that she was with, Aspen, I believe. And so she's been with ACHEC for some time. She's on a new role now, and she's doing some really, really great things. We had a health fair, which I'll talk about a little bit later on, where her booth was extremely creative. About aspirations and things like that. So she had little people doing little great things about what they're going to be in the future. And so Autumn is all about positivity, and she's all about getting right down to the bottom of what our social ills are in this community. And so she's going to do a presentation about the social determinants of health. That's a term, that's a phrase that we all have heard in our industry, or maybe you haven't heard that, social determinants of health. But what does that really mean? What are social determinants of health? Okay. And so Autumn is going to talk about that this morning. She's got a great presentation to educate us all a little bit more. Without further ado, Autumn Trice-Johnson. Thank you. That's a wonderful introduction.
Okay, so I will just jump right in. You can go ahead and advance since you have that lovely introduction. Feel free to stop me with any questions you have, but there will also be a little time for questions at the end. So just a quick overview of what we're going to touch on today. We're just going to start with a basic definition of what the social determinants of health are. We're going to have some examples of what these look like. Then we're going to go over some local data, things we're seeing in Allen County and how our social determinants of health are showing up there, and then just a couple of solutions we can do to address them going forward. So the social determinants of health are the non-medical conditions we are born into and live in that influence health outcomes. And social determinants of health account for between 30 and 55% of our health outcomes, even more so than our lifestyle factors or even our health care. Thank you. And so I just have 6 categories here that we're going to break down as examples of social determinants of health. So education, literacy, language, early childhood education, higher education, high school graduation, things like that. Economic stability, so our income, our social protection, our safety net programs like disability, social security, employment and job security. Food, so our food access, hunger, nutrition and security. Healthcare system, so our access to quality and affordable healthcare services, provider bias, provider availability, which we'll talk about, and then cultural competency. Our neighborhoods, so our housing, transportation, safety, parks, the walkability of our neighborhoods, and then lastly, community, so social inclusion, discrimination, community engagement. These are all kind of things that fall under these umbrellas here. So we'll take a look at how we see these playing out in Allen County. So as far as our healthcare system, so provider availability, we're at about a 534-to-1 ratio of primary care physicians to us here as a population in Allen County. For food insecurity, we have overall 12.6% of the county is experiencing food insecurity, but that's even higher for children. We're at about 17% for them, which is not okay. And then for poverty, we've got about 13% of the population living in poverty right now.
So that represents 534 is the people versus one physician?
Yes. Unemployment, so at the city level, we're looking at about 3%. At the neighborhood level, which is a little bit more in depth of a survey, we're looking at 6%. Our education, we have overall 89% of the population has a high school diploma or equivalent, but there are certain areas with as low as 66%. And then language, which ties into both education, social inclusion, and neighborhood. We have 11% of our families here speaking a language other than English at home, which indicates that English is not their primary language. And then just to put that into perspective of how these things affect the health of our communities, we're gonna look at the life expectancy gap. So in Census Tract 17, which I'm sure a lot of us are familiar with, the life expectancy, which is 46803 zip code, is 66 years. But as we move to the more affluent parts of the county, 46804 even, the life expectancy is 86 years. So that's a 20-year age gap between some of our more poverty-stricken neighborhoods and our affluent neighborhoods. So what are the missing pieces? The short answer is community. So community-based participatory research is also abbreviated CBPR, but this is a method of research. It's relatively new in the last 15 or so years. But it really works to balance out the dynamic between the researchers and the researched. So rather than doing research in communities, we're now doing research with communities. And this style of research has really shown efficient in targeting social determinants of health. And you want to think of it as if you go to your realtor and you say, hey, I need a house. You wouldn't just expect that realtor to go find you a house, buy your house, sign the papers and say, here you go, your payment is this much, I found your house. You'd be like, but you didn't ask me what I wanted, or I had no say in this. So we kind of find ourselves doing that in solving community problems, but we don't involve our community. So there's no community buy-in, and we ultimately kind of miss the point of serving the people we hope to serve. And then relationships. So Purdue Extension has a program called Bridges Out of Poverty, where we go a little bit more in depth about this. But there's just emerging research that shows that relationships are kind of a tool to combat those living in poverty, because if you think about it, our relationships build our social capital. They help encourage our social mobility and our social economic advancement. And then we're forming relationships where we're finally reaching the resources that we need. We're no longer operating on that low part of the hierarchy of needs pyramid. So we're moving upwards in our communities and in our counties. So I say all this to say, and this was a very short presentation, I kind of just wanted to give you guys an idea of what we're looking at. But when we think about solutions for our community, we really want to think less about doing for our community and think more about being with our community, because that's kind of how we get to the heart of the problems and really identifying what the true needs are rather than just the symptoms of a need. So that's really all I have. I know that was really short. But yeah, are there any questions? Awesome.
Well, I have one.
Yeah.
In response to these issues, what is that looking like?
So we have certain action teams throughout the county where we have a group of people that focus on housing and a group of people that focus on, food access and those things. And while they're doing great work, the CBPR approach kind of binds them all together and then brings in the community and says, this is what we see through our research. This is what we think is the logical answer. And then the community members come in and say, well, this is actually not our priority here. This is kind of just a result of this need not being met. So we do a lot of focus groups where we bring the community in the initial phases of research, and we want to know what they want, but they're often left out of the planning and the implementation. So that really just looks like bringing them in long-term for the duration of the project, so that we're ensuring that there's that community buy-in, that there's respect for the culture, the languages of the community, and so it's just a more holistic approach. Does that answer your question?
Yeah, I guess my next question is like, so do you connect with like the people, so like our church, we're located in 46803. So currently we have a steering committee and we're looking at addressing some different things and potentially being kind of a resource center or some type of service center, but it would be great to like connect with you all to see your research, or I guess that's my question, are you connecting with the people that are already on the ground doing some of the work in the communities?
Absolutely. So in that instance, I don't think there's any need to recreate the wheel, so to speak. So just utilizing the resources that we have available, and then rather than duplicating services, seeing how we can kind of fill in the gaps that aren't there to kind of form that wraparound for the community. Does that make sense?
Yeah.
So yeah, just utilizing the things that we already have. So many of you are probably familiar with the Parkview Community Needs Assessment that they do every couple of years. And when they had their sharing session this past year, there were lots of community leaders and nonprofits, but there wasn't anyone from the community there. So when we're brainstorming ideas, if it's like, well, this community is suffering from obesity, what can we do? And someone's, more obvious answer is, well, let's just give them some fruits and vegetables. But that kind of misses all of the root causes, because obesity is normally, just a symptom of something greater. It's not really the direct problem. So things like that, when we're utilizing the resources, like, hey, Parkview has this data already, but how can we connect with other organizations who are in the community and see what the real issue is?
Colleen Carpenter online said, Stop Suicide and several community partners just wrote a grant to do community-based participatory research with Black youth to better understand and address suicide, which is increasing for Black youth.
Yay! Yay! Colleen is awesome, by the way.
Yes, she is.
Yeah, so I would definitely, Colleen, if you want to put your contact information in the chat, I would strongly encourage you all to reach out and get involved any way that you can, because that's really where it starts, in the community.
So,
yeah.
So Autumn, you talked about the social determinants of health and what those are in terms of, moving beyond just the physical aspect of health. Now, Purdue Extension is doing some things or has done some things to actually address social determinants of health. One that I'm thinking of is Johnny May Farm. Can you talk a little bit about how something like that actually addresses social determinants of health, like access and where you live, environment?
Absolutely, and I think that also kind of touches on a little bit of what I mentioned of community buy-in, and Jared can probably weigh in on this as well, but that kind of started as...
And first, you might want to tell people what Johnny May Farm is, because not everybody knows.
Yeah, Johnny May Farm is an urban farm that is kind of owned by the city and managed by Purdue Extension. It's in the Renaissance Point neighborhood, so it's off of Winter Street. And we have markets every Friday with fresh produce. And I can give anybody more information about that. But Johnny May Farm kind of started as a solution to the food desert problem and the food excess problem in that neighborhood. And so logically, we see a food access problem, here's a farm, but there's no community buy-in, because when we talk to the community, and this is something that Jared shared with me recently, when they did the focus groups and they talked to the community, food wasn't really what they even identified as needing. They wanted a safe space, they wanted a community hub. And so now we've kind of mastered, we've got our produce growing. So now we're trying to really meet what the community wants, because it's a great space. If you guys want to stop by anytime, let me know. But we're trying to make it so that there's an opportunity for education to happen there, but there's also just that feeling of a safe space, of like a family center and kind of just a neighborhood meetup for that area.
And then when you're talking about social determinants, you also mentioned, I know education, economics are also issues that impact how healthy people have the opportunity to be.
Yes, exactly.
Which is what social determinants address. What is the opportunity that we have to be healthy? And so I know that Purdue Extension also does classes on those types of things, and those classes you can take to different organizations, right?
Absolutely. So within Health and Human Sciences, which is my room. I focus on food, family, money, and health. So that's a really broad range. I do serve-safe food handler and food protection manager courses. I have budgeting courses, financial wellness, mental health, family dynamic courses, parenting courses. So we really try to offer a broad range of programs to kind of improve health from a holistic standpoint. But we also have education in agriculture. So we have horticulture, beginning gardening. We have community development, leadership, knowing your local government, things like that. And we also have 4-H youth leadership development. So we try to, kind of hit all the areas of people to reach. But we really do have just a host of information and programs that we can do.
And so how can people get access to those programs? Would we contact you or
Copy, yeah. So if you go to the next slide, my email and my office phone are here. Our county website is there as well. So yeah, please reach out to me. I'm happy to connect you or provide any education for you or your groups that you are interested in.
Were we getting some interaction online?
We did have another question here.
Sure.
Carlos wants to talk. Yeah, Carlos said, can I speak on what MH is doing for social determinants of health?
Absolutely.
So
Sure.
I'm gonna go ahead and throw him up on the screen.
Hello, can everybody hear me?
Yes.
Yeah, I just wanted to, because I can't see the gentleman that's off screen. He asked what was being done for social determinants of health. So I just wanted to kind of comment that what we do at Neighborhood Health is after we have our appointments, our provider appointments with our patients, we have an evaluation with each individual to talk about some of the things that they may be dealing with outside of a medical appointment, whether it's utility assistance, kind of like what Autumn talked about, kind of food, to address some of the food insecurities, especially in the 03, also the 06 zip code. So we have evaluations with our community health navigators and some of our nursing staff just to see kind of what people's situation is outside of the medical appointments, to kind of have that conversation and build that relationship to see however we may be able to address whatever need they may be going through. Health determinants is kind of vague terminology for, social determinants is vague terminology for a lot of things that we believe may deter people from coming to a medical appointment. So we have language interpreters, we have social workers that are here to address some of those things that may be going on outside of home that they may not feel comfortable enough until they build a relationship with some of our staff. So we have all of these things instituted within what we do at Neighborhood Health to address some of those social determinants of health. So whatever they may need, even if it's referring people to a lot of resources of some of the people that may be in the room. So we are super excited to work with Autumn and Purdue Extension, as well as, I can't see him, he's off camera, but whatever church organization you have, we would love to sit down and have the conversation on how we can address some of these social determinants of health, whatever they may be.
Awesome. Thank you, Carlos. Any more questions for Autumn? Okay, thank you so much, Autumn. Here at Health Visions Midwest, social determinants of health is one of our focus areas as well. In fact, that is what Cassius Stallings, our wellness coordinator, is addressing with a lot of the programming that he's doing and will be doing. And so he's going to talk a little bit about one of his programs later on that hits directly on that. That's coming up June 1st, okay? So without further ado, I want to make sure we have enough time for our second presenter as well. Patty Rose is a woman that I just met like last week. And she's with an initiative called I Hope, and it stands for something. Okay, let me see if I put it in here. Yes, Indiana Healthy Opportunities for People Everywhere. Some of you may have heard of I Hope. Has anybody heard of I Hope in the state of Indiana? Okay, Patty, you've got some work to do in educating us about I Hope. They just come to Allen County, but this is an initiative that has been in some other parts of the state for a while now. And so I want Patty Rose, and I'm going to tell her to explain her role and what iHope is. You got the agenda, but they're here to help organizations like ours. They're here to fill gaps. And so we want to give her the floor so that she can alert us to all that they have to offer in assisting us to help others. Patty?
Or take myself off unmute. I always have challenges with that mute button. Now, am I in presentation mode? There we go. Technology. All right. Can everybody see my screen? I can't see you. So.
We see you.
Okay, great. Thank you. Yes, thank you so much, Sharon, for the introductions. And I am honored and privileged to present. With Sharon and I just met last week. She's marvelous. You guys are doing awesome work. When I heard there was a health equity coalition in Allen County, it's like, every county needs a health equity coalition. So kudos to all of you in this group. Yes, again, I'm Patty Rose. I am the lead health equity analyst for the Purdue iHope team. And Sharon is correct. iHope stands for Healthy Opportunities for People Everywhere. It is a grant that we received back in June of 2021 with through the CDC to address COVID-19 health disparities, health equity, for 3 years. We are just entering, like Sharon said, Allen County, doing some listening sessions. So just kind of wanted to give a broad overview of our work. I don't really need to define this. I think everybody in the room knows what health equity is, but I've always loved to show this little, and I'm sure many of you have seen this little graphic before. All people have the opportunity to be as healthy as possible. Equality. You know, I love this little picture that, these kids, these individuals have boxes that they're trying to peek over to watch a sporting event. But, the shorter one, the little person in the wheelchair, they can't see. So that's not equality. So the right picture, it shows, they've created some boxes to be able to give them the ability to access opportunities that are out there, even though they may not be as equal as the other. We're all human. We're all, despite our hair color, skin color, racial, cultural, we're all the same. We're all one, we're talking faith-based. I often tell my sons, we are all God's children. So I truly believe in that. I have a strong faith. So anyway, back on, this is a little slide of the health equity analyst here at Purdue University. We have Angie Washburn. She is our health equity analyst in the southern counties. Corey Jackson, he is in Lake County and St. Joe County. Myself, I am over Allen County and Cass County. And then Tisha Reed is our lead health equity analyst. And then Sylvia Saxena is also one of my colleagues working in Cass County. And I've noted below there the list of counties that we were working on. We initially, when the grant began, we had 30 counties out of 92 counties in Indiana to work in. As we all know, capacity-wise, there was no way we were going to get that all done in 3 years. So we reduced it to 13 counties. And maybe you're asking, why just these 13 counties? This slide shows where we're at. The first 5 counties that we worked in starting in the fall of 21 were Cass County, Clark County, Elkhart County, Lake County, and Wayne County. Maybe you're wondering why those first 5. They had the highest social vulnerability index, basically meaning they were in the red zone. They had the highest need in those communities coming off the pandemic. In 2021, we were in the pandemic. COVID-19 rates health outcomes were really bad. The remaining counties, as in Allen, they were more of the yellow zone. There was a high need, but not as severe as the first 5 counties that we worked in. So right now, like I mentioned, we are conducting listening sessions and we're working closely with our Purdue Extension friends. Autumn, amazing presentation. I have been passionate about social determinants of health way before the pandemic hit. Big need. A lot of people don't understand them where we work, live, and play, but great presentation, Autumn, and I look forward to working with you. So on to the next slide. Let's see here, addressing social drivers to advance health equity. Purdue iHope team, we have focus areas that we're focusing on mental health and substance use. Food and health, food insecurities, as we all know, is huge. It was a big issue prior to the pandemic. The pandemic just kind of exacerbated everything. It just made everything 10 times worse, especially right now. A lot of, the high price of groceries, a lot of donations are down in our food pantries and food banks. Big problem with food insecurities right now, infectious disease. What can we do to the next, hopefully in our lifetimes, we don't experience another pandemic, but what can we do as a community to address the health issues? Underlying health conditions during the pandemic were at risk, HIV, hepatitis, heart disease. And so we're kind of stepping back and taking a look what we can do or help build capacity within communities. And then there's emerging issues, maternal and infant mortality and human trafficking. Allen County is doing fantastic work surrounding infant and maternal mortality rates. It's all about the babies and the moms. A lot of work, it takes a village, we always say, always opportunities to move forward. So we're kind of talking with folks that are in those sectors. And then we have at our hands Purdue faculty expertise. We have over 100 partners that are on our I Hope initiative, as well as Purdue University campus. We're working closely with the Brian Lamb School of Communication in helping develop, I don't want to say he hates the word, Evan Perot is the professor we're working with. And he does not like the word, I don't like to use hate. He dislikes the word marketing, but we're a health promotion. What can we do to help educate the communities with certain tools? Everyone knows social media is a big thing. So there's a lot of areas that we are focusing on, and then looking to build capacity building in communities. Forging partnership. We're looking, who can we partner with? What coalitions can we come and walk alongside? What can we do to help drive the work that they're already doing? We have a lot of tools, connections throughout the state. Organizational development, governor assistance, seed funding. We do have some seed funding that's going to be coming available really soon to help advance the health equity. Grant writing assistance, we have partnered with Purdue Extension. I actually went through the course myself last week in Lake County. Lupe, I don't know if any of you are familiar with Lupe Valterra at Purdue Extension in Lake County. I sat in on an all-day class. There's a second session coming up in June. I was exhausted. I kind of had the gist of what it goes into writing a grant, but I was exhausted by the end of that class. It's a lot of work, but free money, it's worth it. So that possibility, we may be able to roll that out in Allen County as well, that free grant writing assistance. Evaluation assistance. We have a team of evaluators on our team as well that can help evaluate. We can help do surveys. Surveys are wonderful to an extent, but then you have the data, what do you do with it? So we can help with that. We also have process improvement. We have, maybe some of you have heard of Lean Six Sigma or Lean Daily Improvement. We have a process improvement team that can come in and provide process improvement, workflow enhancements to the community, and as well as evidence-based tools and resources that we work with as well. This is a little example of some work we're doing in Cass County surrounding infant mortality. This is along with the Brian Lamb School of Communication at Purdue. We developed a sticker that is this was the sticker on the left, and then this is actually, we're working with the food pantry in Cass County, the MS Mission Center Food Pantry. I don't know if maybe some of you know Jason there. But there was a need to help promote safe sleep is what we landed on, the ABCs of sleep, alone, on their back, in a crib. And we partnered with the I can never say that word, MAS Mission Center Food Pantry, and then Logansport Memorial Hospital. And we created these stickers that, here we are trying to address safe sleep. And then also it helps the food pantry, because initially when we visited, they were just writing on the food bags, potatoes and the date with a Sharpie. We're like, why not create a sticker to help promote safe sleep? It helps the mission. Mark can clearly say what's in the bag. And then we also, metrics, we want to measure the engagement of the individuals in promoting safe sleep. We created a QR code there's this survey. It has a few questions in that QR code, and then it has a link to resources that are available in Cass County. So hopefully we can help move. We won't know this. We just rolled this out last week, putting the sticker on the food bags. And this sticker is big. It's a 5x10 sticker. So stay tuned for the outcomes of that. And then we're also partnering with the Latin grocery stores. There's also in Cass County, there's a Haitian Creole population in Tyson factory. And so there's a Latin grocery store and there's a Haitian Creole grocery store. So we're partnering them possibly and putting messages on safe sleep on their grocery bags. So that's another project that's still in the works. And then some work that we're doing in Lake County. We had a large community strategy event back in June of 2022, where we had over 100 participants, community members that met in Gary, Indiana at a church. And one of the tables, the topic was focusing on education. And this was the project they landed on with the 21st Century Scholars. It was brought to our attention that only 50% of the youth that are eligible to apply for this 21st Century Scholars actually apply for it. So there was a need. So with the help of our Brian Lamb School of Communication team, we targeted a pilot project, the Hammond School District, Hammond School Board we met with, and we sent out over 832 letters to families in the Hammond School District with a partially completed 21st Century Scholars application. And then they also held workshops at the school for parents, families to come and for help, additional assistance. I understand those applications are a little bit challenging, trying to reduce stigma surrounding the 21st Century Scholars and promote that is available. Interestingly, I do want to share that on one of the calls, we have workshop or work meetings every 30 days. A government legislator from downstate was invited to the call. He wasn't aware that all these issues surrounding the 21st Century Scholar were happening. So he reached out to the governor's Public Health Commission, said, hey, what can we do about this? And apparently back in, several years ago, there was a bill on the docket to auto-enroll 21st Century Scholar students that were eligible for it. It fell off. It did not get approved, but if any of you pay attention to bills that are on there, recently was pushed through because of this gentleman that was on this call with us. They pushed the bill through. I think it's on the governor's desk to sign, to automatically enroll students that across the state of Indiana that are eligible for the 21st Century Scholars. So that was a huge achievement. We were very excited about that. So that was one of the projects. And then now that we're in Allen County, I didn't realize, but there are 42 zip codes in Allen County. That's a lot. And every community is different. As you know, the city, I think just the folks that we've talked with so far, zip codes 03, 02, greatest need. I know Autumn mentioned some statistics on education, high school diploma, 80-some%. But in other locations in Allen County, it's only 66%. So that's concerning. A zip code can be, 2 blocks away, be a different zip code. And the life expectancy, as Autumn talked about a little bit, can be, 10-year difference just from 2 blocks away. So there are definitely some concerns and work to be done. And then I love how Autumn's presentation and the work that we're doing under iHope, they really do tie together. And like I said, we are working closely with Purdue Extension friends. Ashley and I are going to be working on a project, and we met with Autumn and Jared. I think Jared's on the call. But we're all in this together. We want to help as much as we can build these partnerships, make connections, break those silos. Again, like I mentioned earlier, it does take a village. And I will share these slides after the presentation today with Sharon, and she can distribute those to everyone. And these are just some of our partners. And I did put into the chat a link to our website. I highly encourage you to check that out. It has a full list of all of our partners and some more information. And I also put my email address. If any of you have questions, I would love to connect with several of you that I've not talked to yet. I know Carlos was one, and I think there was another gal, Colleen, I think. So Please reach out if you have any additional questions. And I guess at this time, Sharon, let me see, I'm going to stop sharing. And if there's any questions, I'd be happy to answer.
Questions for Patty? That was a lot of information. As you can see, she is here to help us, to help our organizations to fill gaps, to fill voids in the services. They have some influence, and that's what they were created to do. So who needs some help here? Who has some questions for Patty so we can get some extra help? Okay, Miss Sheila.
Well, we always need help. The space that I'm in is environmental justice, but this health kind of is in this line with the same thing. So how do we get the church more involved, and would they be willing to work with us?
Do you hear her, Patty?
No, I'm sorry. Could you repeat that question? I'm not able to hear.
So what she's saying, this is Sheila Campbell, and she represents a whole bunch of different organizations. She's actually on the Health Visions Midwest Board of Directors, but she is today representing, who you representing today? Pilgrim Baptist and Midwest?
Pilgrim Progress Community Development Corp.
Pilgrim Progress Community Development Corp, and she's wondering how your initiative can partner and help churches, especially in some environmental issues that they are endeavoring in. They want to make our communities more socially conscious about environmentalism and things like that. Yeah. So how can I help in that issue, that realm?
No, great question. Thank you for asking. And it was Sheila, I believe. Sheila. Yes, we can certainly. I would love to schedule a chat with you to see how we can further assist. But environmental issues, we're doing, and you're faith-based also, is that correct?
I'm a CDC. I'm also faith-based. I mean, like I said, we have a couple of 501c3s. One of the spaces that we're working in is electrification, decarbonization, electrifying buildings, churches, taking folks from gas to electric, indoor air quality, energy assessments, but health. I mean, you're in my wheelhouse. Thank you.
Yeah, no, yes. Okay. Thank you for sharing. And I could hear you that time. But yes, as we are part of Purdue University. And as I mentioned, we have connections with faculty and teams. I'm sure there is someone I can loop you into to help address that. There may be work already happening on campus. Off the top of my head, I don't know of anybody, but I am happy to dive in to find out what work we can do to help move that along in Allen County. So Sharon, I don't have your, not Sharon, but Sheila, I don't have your email, but I can get that from Sharon. If you're okay, I'll reach out and see what we can do.
We can definitely connect you. Okay, anyone else? Question, you see how she's willing to fill in the gap, to do the legwork, to see what can be done to meet.
Colleen had her hand up.
Who?
Colleen.
Colleen, go ahead.
Hi, Patty. The Stop Suicide Northeast Indiana Coalition is doing strategic planning, and we've collected a whole bunch of data to look at suicide from multiple angles, from those who are seen in the emergency department, who had thoughts of suicide, those seen in emergency department that have had suicide attempts. We've got survey data of youth that have expressed ideation or had an attempt, and then we have suicide death data. And so we're sort of drowning in data and we're trying to make sense of a whole bunch of data. And I don't know if I know you have an evaluation assistant sort of line of services. Would that apply to helping us better understand the data we have?
Yes, absolutely. Like I said, mental health's a big focus of ours across the state. Huge need, our kiddos, everybody. But yes, we can help with data. We just worked with St. Joe County in helping them evaluate. They had all this data. Like I said, what are they going to do with it? So it's overwhelming. We're all short on resources. So that's what we're here for, to help in those areas. So Colleen, I will get in fact, I think you shared it in the chat function. I will reach out to you and we'll get together. But absolutely, that is something that falls in our wheelhouse and we can help you with. So
thank you so much.
Right.
Any additional questions for Patty? Okay, So, Patty, thank you so much for this
Thank you.
information. We, I think, know a little bit more about iHope, and there's probably much more to learn. I'm sure you'll be hearing more about iHope in the weeks and months to come as they really get ingrained in Allen County. And I do like how these presentations dovetailed off of one another, talking about different social determinants of health. So thank you both, Patty and Autumn, again for your presentations and for enlightening us a little bit more about things to come. All right, so if we can move to the updates portion of our agenda. I do have some updates from, okay, people are sharing their information, connect information in the chat. I do have some updates for Health Visions Midwest, and then we'll get to sharing all of the things that you all are doing and networking a little bit. So first of all, I want to thank all the organizations that were able to participate in our Mind and Body Wellness Expo on Saturday. It was a huge success. Thank you, thank you, thank you, thank you. Can I get a hand clap? Can I get a whoop whoop, okay? Okay, so most, if not all of the participants were A-Check members. And so I am very, very grateful for that. We don't have all the tallies tallied up, but we had more than 100 people come out and get screened. I know it's more than 100 because we ran out of sandwiches. And then some people didn't even get sandwiches. So it was well over 100 people. And we had a lot of screenings. We had a variety of screenings that admittedly I was doubtful people would partake in that setting. It was at Elevate City Church, so we obviously want to thank Elevate City. But we had everything from STD testing to HIV, to blood pressure, weight, childhood immunization, shingles. I got my shingle shot. We had everything there, okay? And people, the lines were, there were lines, okay? We had a high Burmese turnout, which I wasn't expecting, which was awesome. And I say that only because I didn't have an interpreter there. So we are looking at some things that we can do to improve for our next Wellness Expo. And so along those lines, if you have some comments that you want to share about your participation, please do so. I would have a survey, but Felicia's not here. Felicia's on vacation, so I don't have a survey. So if you have something that you want to share immediately, a way that you say, hey, next time this would help improve on this even more, or this was great. So please, if you have that information and that comment, please just send me an email. I would love to hear it. If you want to participate next time and you say, what is Sharon talking about? What was the health wellness thing? And somehow you missed that. Let me know that you want to participate next time, and we will get you involved and looped in. It was really, really good. That's one of the best expos that we've had since I have been here in the past 3 years. It was really good. Okay. Any comments that I'm missing about the expo? Again, if you have some comments, if you have some things you want us to improve on, just let me know. My feelings will not be hurt. We are all about getting better and doing things even more excellently. Okay? So let me know, or something that you want to praise. Let me know. All right. Another couple of other updates. We've got an exciting program coming up, y'all. As you can see by this lovely, lovely flyer here. And I'm going to ask, as I'm talking, for Peggy to maybe hand some of these out. Oh, I can hand these. Oh, I don't want to trip. Okay. I don't want to risk tripping. Okay, we've got a program coming up on June 13th called History Heals. And History Heals is something new for us. And this is, it's going to be a Fort Wayne community conversation. And we're going to be talking about some issues dealing with race that have come up in our community in recent times, okay? And how we can dialogue about those. We did a lunch and learn a few weeks back called racism and equity, health equity, because racism is bad for your health. That's one of the things that can affect health. It's not, you know, your diet or what have you. It's not exercise, but if you're under stress because you're feeling that you've been discriminated against or you're experiencing microaggressions, and we've got a diverse population here, every people of color, including Burmese folks, Latinx community, African Americans, just all kinds of folks, refugees from different countries. If you're feeling that stress, that can affect your health, right? And so here's some topics that we're going to talk about at History Heals. It was laid on my heart that the more we know about our history and the more we begin to acknowledge and dialogue about it in a healthy way, that is healing, okay, for our community and for the people involved. So we're going to talk about blackface. That's an issue that has come up in Fort Wayne in recent months, and why that is offensive. We're going to have Roberta Ridley from the African American Genealogical Society of Fort Wayne. She's going to talk a little bit about that. We're going to talk about racism and mass incarceration and jail reform. The issue with the jail has come up. So Quentin Ellis, who's a longtime attorney in our community, he's going to talk a little bit about that. And then we're going to talk about this initiative to change Calhoun Street, which is named after John Calhoun, to Martin Luther King Jr. Boulevard, okay? And that's Chris Lahr with the MLK Club is going to be talking about that. You can find these bios for all of the people who are going to be talking about this at the Eventbrite, and I'm going to be moderating, okay? Now, this is not to say, let me say this. We just want to talk about this. We want people to have the information to talk about it. You may not agree with all these things. That's fine. That's cool. Come on out to the auditorium because this is about dialogue. This is about learning from one another. This is about healing in our community and for different people. So that we've got, and it is in partnership with Allen County Public Library, and that's why we have these beautiful poster boards because they printed them off. So thank you, Melissa. So yes, it's going to be at the library. Please take one of these posters and hang them up someplace and know about that. Cassius, I want you to talk just a minute about your program that's coming up. Yeah. You don't have to, but okay.
So we'll share this with you online and you all have it in person. So on June 1st, myself and then these three individuals with some of our local youth chapters. So Cameron Shackelford with the YMCA, and then Cameron Charlton with Youth for Christ, and then Alexia Hernandez with Building a Stronger Family. We'll be talking about, you know, our youth this summer and how do we better engage and empower them. You know, a lot of times summer is idle time for kids. And so how do we combat that? How do we come around our kids and surround them? And so we'll be having a conversation, you know, and I encourage everyone to tune in, register come June 1st. It's during the lunch hour, so it's a working lunch, so it's 12 to 1. And again, we'll just have a conversation about, you know, better empowering and engaging our young people for the summer.
All right, another social determinant of health. Okay, what are the opportunities that young people have to be engaged, to do healthy, positive things so that we can live healthier lives, okay? Makes sense? Another thing on there is June 28th is our Rethinking Health event, this time with Zach Benedict. And he's going to talk about community development, health, and well-being. That is June 28th at 9:30 at the library. It will take the place of our June HEC meeting, but it starts at 9:30. We don't have that flyer because I couldn't find it because Felicia's not here.
Felicia is
Yeah, so we rely on Felicia for a lot. She is amazing and awesome. She's just on vacation, which is well-deserved and needed. So that is all we have. Now we want to take events from our participants here today. I want to take who online has something that you want to share first and foremost. Colleen already has her hand up. Come on, Colleen. What's going
Hey, everybody. Sorry I'm contributing so much, but this is such a great meeting. I've learned a lot. It's so cool to see so many people doing great work. Anyway, we have a free QPR training, which stands for Question, Persuade, Refer, coming up we're holding it at the FACE Center, the Family and Community Engagement Center of Fort Wayne Community Schools there at Douglas and Clinton. It's on June 1st in the morning, so we are not going to conflict with the last event that was presented. I want to be at that one. That's going to work out great. It's from, I believe, 8:30 to 10. Boy, I should know that, but I will get the flyer out to Felicia if she can get it out. And that's basic suicide prevention 101. If you're someone who is leaned on a lot for support in mental health crises, I recommend a more advanced training called ASSIST, Applied Suicide Intervention Skills Training. And that helps you learn how to respond to someone who's thinking of suicide and help create a safety plan, not out of fear or what your organization wants you to do, but well, that is integrated. But what does that person who's having thoughts of suicide need from you to create a doable, workable safety plan to keep them safe for now? And that is coming up twice at Remedy Live. And I will send those dates out there, the 10th and 11th, which is a weekend in June, but then we'll have a Monday, Tuesday, July 24th, 25th. We also have a golf fundraiser coming up. A man who lost his best friend to suicide decided to start golfing in honor of him. And that is our only fundraiser for Stop Suicide. So if you like to golf, please come out July 8th to Eel River. I will send that information to Felicia. And I think that's it. Oh, wait, no, one last announcement. For those of you who know people who have thoughts of suicide or have had a recent attempt, we finally have a support group for those folks. And it's taken a long time for Indiana to figure out what to roll out for people thinking of suicide and to get them group support. And it's called Alternatives to Suicide. And it will start meeting in early June at the Center for Nonviolence. I believe it's the 6th, but that also I have a flyer for, and I will get that out to Felicia. Thank you.
Awesome. Thank you so much, Colleen. And suicide is a big issue, especially in Allen County. Here in Allen County, what I have heard and been told is that we have a higher rate, a disproportionately high rate of suicide among men of color. Is that still true, Colleen? Yes, she is.
Yes, that is true. And that's why we wrote a grant to address and among youth of color too. So we're hoping to get funding by the end of the summer to start looking into why and what can we do about it.
Yeah, so don't sleep on that, folks. I mean, we so often think everybody in our, circle is cool and okay because they've not said openly, hey, I'm not, feeling like living anymore. But there are some things that we can do to prepare ourselves to see signs and to see things that are going on in people's lives so that we may have an opportunity to make a difference. Anybody else virtually who needs to share something going on real quick? Do we have any things in the chat? I saw some dialogue or something going up.
Chat's just been asking for flyers.
Okay,
so
we will get the flyers out. When, guess who gets here? When Okay, all right, so we're going to go in the room. Who has information and events to share? Okay, yes, Anne.
I have two.
Yes.
One is a link went out a couple weeks ago about a transportation survey for Allen County. And then we are also doing a regional assessment with Northeast Indiana. So another link is going to come out. There are two different surveys with two different purposes. One was done by NERC and one is with CTN and a consultant company. So I will get that to Felicia when she comes back. And hopefully we can get that information out. And please share it with the people that you serve. We're gonna have a different survey coming out for organizations that you guys would fill out. But this first one is for the community and individuals.
So this is Ann with CTN, everybody.
Yes,
She's
sorry.
going to be distributing these surveys for people in the community, talk about their needs and how CTN can better serve. And you all do have a new service for grocery stores
That
now?
was the other thing I was gonna say.
Yes.
This month, we started, a grocery service, we started, it with, the Housing Authority. So, right now, each Tuesday night, we're shuttling to grocery stores from different Housing Authority. I'll get you the flyer when Felicia gets back on the locations. It's a new initiative, we're getting a good response so far, and it's not only for, those that live in housing authorities, it's for anyone in the neighborhood.
That's
And
just the stop.
That's just the stop.
Yeah.
So yeah, anyone around can use this service, and like I said, it's shuttling back and forth to the grocery stores. It's free, thank you Three Rivers Federal Credit Union. And we are working to add Saturdays, stopping in other housing authority locations as well as some neighborhood community centers.
Awesome. So let me explain. So our camera we don't have a camera that goes all the way around, so she's out of the visible sight or the reach of the camera. So there are some blind spots. So that's why it stayed on me as opposed to looking at her beautiful face while she was talking. Anyone else have events that you want to share, something going on in your organization? Okay, Kiona, can we get her? Just, okay, she's.
Right, quickly, every Monday I have Tai Chi, Qigong. Tuesday,
That's your Cancer Services of Northeast
Correct.
Indiana.
Thank
Yes.
you, 2:30 to 3:30 p.m. Tuesday I have stretching strength, 2:30 to 3:30 p.m. And Thursdays, Diane Rogers teaches my chair yoga, 2:30 to 3:30. This is all at the Impact Center. This month, next month, coming quickly, I have Chief Condorilli coming just for some relaxation and storytelling. So if you come out to that, that would be great from 5:30 to 6:30. And then watercolor painting, June 26th. So if you can make it to that, just some relaxation. And for cancer services, for our programs, you do not have to have cancer. Okay, our programs are free, and you can, it's community-based, and you can bring your family and friends with you. Okay, I mean, definitely if you have cancer, know someone who does have cancer, bring them, but you do not have to have cancer for these services. And then also, coming in late September, but a night to remember, and it's Thursday, September 14th, from 6 p.m. to 9 p.m., and that's our tribute dinner.
Wonderful. So you're going to be passing some of that information.
I did already.
Oh, okay. All right. So yes, thank you, Kiona, Northeast Cancer Services of Northeast Indiana, doing some great work out of there. Okay, so we're going to go with Miss Sheila in the back, who's out. She's in the blind spot of the camera, everybody.
You guys hear me,
Yeah.
Yeah, on June 21st is the first day of summer. With the Fort Wayne Urban League, we're doing asking Save Kids, asking if there is a gun where your child goes and play on the first day of summer. So we're calling this Trauma-Free Day. We love for anybody that would like to partner with this. We're gonna make this ice cream social chalk walk. Also, the month of June, Pilgrim Baptist Church, our green team will start our summer program for our youth. That will be Monday and Tuesdays from 10 until 3, and we'll make sure Felicia gets that.
All right. Amazing. Yes, and yes.
I'm Kelly with Associated Churches. I just wanted to let everybody know we're having a Father's Day 5K on the Saturday before Father's Day. What this supports at our organization is a baby's closet and Journey Beside Mothers. A baby's closet is where moms and dads can earn coupons by meeting their educational needs, by going to doctor's appointments, etc. We also realize that mental health needs of moms were very important. We really realized that before COVID, but that just accentuated it. So with Journey Beside Mothers, we are matching, just in a nutshell, matching moms with mentors so they have someone to connect to, because we know so many of these moms are very isolated. So I'd like to just, if you want to know more information about that, just let me know. We're trying to create community for moms who don't have community. So.
Wonderful. Awesome. And then that social piece is part of what? Social Determinants of Health. Yes, the relationships that people are able to have and the resources that they're able to have with other folks and with organizations in the community. So thank you, Kelly, and the work that you do with Associated Churches for that. Anyone else want to share some information? Something's going on? Yes, Ms. Peggy.
I have Thriving Thursdays.
Yes.
I'm having it tomorrow. As you know, May is Mental Health Month, so I'm talking about depression tomorrow. It's here tomorrow from 10 to 11. We will have light refreshments, so any of you are invited. I will have something going on every month. And when Felicia gets back, she will be sending out, more information. So we depend on Felicia for a lot of things. You see why she's on vacation.
She's never gonna be allowed to on a day where there's no.
She's gonna have to do it Zoom.
Thank you, Peggy. Yes, Peggy, yes. Health Visions does Thriving Thursdays. Throughout the month, we do it the second and the fourth Thursdays of each month, Thriving Thursdays. Peggy has a different topic that she submits for that. This month is mental health, as she said. June is going to be another topic. And so, if you have organizations and clients where you would like them to participate in this, like she said, we have snacks, bring a group of folks here. Just let us know in advance. You can bring a group of folks here and they can partake in that. And anyone who does participate gets an incentive. They get a $5 gift card for that. So tomorrow is mental health. It's not too late to sign up. And if you have an organization where you're saying, okay, I can't bring everybody here, but maybe if she came there, Peggy can do that as well. Okay. So thank you so much, Peggy. Anybody else? Yes.
I just forgot to add on, Cancer Services Northeast Indiana. We do a wig drive every year. We've been doing this for 11 years in memory of my sister, Deborah Brown. So if you have wigs, please donate those to Pilgrim Baptist Church, or you can drop them off at the Fort Wayne Relief. Thank you.
And she was so awesome. She brought in so many wigs, so we appreciate you.
Thank you.
Wig Drive. It's an add-on to the Cancer Services and some of the things that they do. Drop it off at the Urban League to Sheila, who again is outside of our camera reach. And when do they drop that off?
We're there Monday through Thursday from 10 to 5. Pilgrim, same hours, 10 to 5.
And when is the cutoff?
There is no cutoff.
Any
We
time
do
of
this
the year.
indefinitely. We usually have something big in October. Our goal is 100. We usually exceed that with 200. So please help us. Thank you.
Okay. Anybody else? Okay, everyone.
Colleen has been.
Okay, Colleen.
I forgot to announce that we are the Stop Suicide folks, along with Building a Stronger Family and the Kingdom to First Ministries are bringing a suicide prevention training to Fort Wayne called Soul Shop for Black Churches. And we have, I think, 40 spots and almost half of them are full. It's July 22nd on a Saturday. It will be from 9 to 4. And it's a really powerful, amazing suicide prevention training for lay leaders and pastors to use the Bible to better understand and suicide and promote mental wellness in their ministries. And
That
it's
is
free.
Awesome.
It's totally free.
That's awesome. Thank you for mentioning that, Colleen. As we said, there is this disproportionate rate of suicide among people of color. And so that's one way of addressing that. We want to take away the stigma of getting professional help out of churches. And so combining that type of training with spiritual leaders is a wonderful idea. Thank you so much. So without further ado, if there's nothing else, I am going to wrap this up for our virtual folks. If you were here, you'd be able to network and get some good bananas and muffins and cheese and crackers. But since you're not going to be able to do that. But we're still grateful for you coming and joining us. We thank you so much for doing that. But in the room here, what we're going to do is we are going to complete the surveys that are before you. We need that for our grand tour. And then you have about 15 more minutes if you'd like to network and get to know some of the folks in the room and share more information. Thank you so much. Yay! Thank you so much. We'll see you next month at the library at 9:30.
Thank you.